When your psychiatric or social work care is in intern hands, navigating care from interns, safety, credibility, and your rights as a patient written, edited, created, and published by Nisa Pasha, executive political health guru, peer counselor, and educator. MentalHealthRevival.org introducing mental perceptions of interns. As an executive political health guru, peer mental health educator, and counselor, I have often pondered my experience with professionals in my sector of studies and professional niche to evaluate and adhere to any experiences in life to avoid pitfalls while providing support to my clients. Today I strive for adequate supportive education and techniques which counsel and educate in informative ways to combat various societal-level issues of political, diversity, and health at the individual, community, and global levels. Therefore, looking back to my very first therapy sessions in elementary school, my first therapy session was years after my childhood trauma, I can now see the early warning signs that my care was not what it should have been. My therapy, who I assumed was a trained and licensed clinician, often appeared more like an observer than an active participant in my care. He would sit silently, nodding while taking notes, rarely offering guidance, education, or meaningful feedback. There was no explanation of the therapeutic process, no discussion about why certain interventions or medications were being suggested, and no acknowledgement of my questions or concerns. Even at a young age, I felt a subtle unease, a sense that something was off, that my voice, my experiences, and my symptoms were not being truly heard or valued. I questioned whether this person was genuinely a therapist or merely an intern, thrust into a position without the necessary credentials, supervision, or experience to provide safe and effective care. As I grew older and moved through the mental health system, this pattern repeated itself. I encountered clinicians, social workers, and other psychiatric staff who either admitted or whose actions revealed that they were still in training, interns acting beyond their scope of practice. My concerns about side effects, medication reactions, or environmental triggers were often minimized or ignored. Misdiagnoses were given without thorough assessment, and my lived experiences were interpreted through incomplete knowledge, bias, or theoretical assumptions rather than careful evaluation. Even when I tried to advocate for myself, the system often failed to protect me. This left me feeling powerless, misunderstood, and at times, physically and mentally endangered. The medications I was prescribed, the dosages administered, and the interventions applied were sometimes harmful because the providers lacked full licensure, supervision, or the accountability structures that are supposed to ensure safe care. Now, reflecting on those early experiences as an adult, I recognize how serious and systemic these issues truly are. They are not isolated failures. They are part of a larger web of structural challenges in mental health care, including inadequate supervision of trainees, institutional neglect, and systems that prioritize procedure over patient-centered care. Beyond individual errors, these practices intersect with broader political and public health concerns. Medications and interventions are often prescribed without consideration of ancestry, genetic predispositions, or biological differences, which can compound risks and create unintended harms. Environmental and systemic factors, such as exposure to pollutants, unsafe housing conditions, and poor ventilation in mental health facilities, further exacerbate vulnerabilities, particularly when oversight is minimal or absent. The consequences of these failures extend beyond my personal experience. They highlight the ways in which unqualified practice, informant-style monitoring, and institutional shortcuts can erode trust, compromise patient safety, and even perpetuate cycles of harm across communities. When interns are allowed, or implicitly encouraged, to operate without proper supervision, the line between care and neglect blurs, and the power imbalance between patient and provider becomes a tool for systemic control rather than support. What I once perceived as passive observation or inattentiveness now reads clearly as a violation of rights, a failure of ethical standards, and an illustration of the broader ways in which mental health systems can fail those they are meant to serve. Looking back, I can also see the resilience this experience forced me to cultivate. Understanding the dangers of unsupervised practice, learning to question authority, documenting my experiences, and advocating for proper care became necessary skills. My story underscores not only the importance of qualified, accountable, and supervised care, but also the need for patients to recognize early warning signs, trust their instincts, and demand transparency. Beyond personal survival, it is a call for systemic reform, one that centers the safety, dignity, and well-being of mental health consumers, particularly those navigating complex intersections of medication, environment, and institutional practice. Questioning credibility of interns is not paranoia. When receiving psychiatric care, the qualifications and supervision of the clinician directly impact the safety and effectiveness of treatment. Psychiatric interns, while trained and supervised, are not legally authorized to prescribe medication independently. If medication, especially powerful, long-acting drugs like Invega Sustenna, is prescribed without the oversight of a licensed psychiatrist, it introduces significant risks to both physical and mental health. This discussion highlights the legal, clinical, and ethical concerns surrounding unsupervised prescribing, explores the potential harms and warning signs, and offers guidance for patients to protect themselves and advocate for safe, competent, and legally compliant care. How valuable or credible is an intern doctor or intern social worker? Interns are legitimate professionals in training, but they do not practice independently. Their value comes from their developing skills, fresh perspectives, and direct supervision by fully licensed clinicians. However, their credibility depends on the strength and involvement of their supervising doctor, not their own level of training. Important facts about interns in mental health settings. They are not allowed to prescribe medication independently. Every prescription they write must be approved, reviewed, and co-signed by a licensed psychiatrist or medical doctor. Their evaluations and treatment recommendations are typically guided and reviewed by a supervisor. They're still learning, which means you may notice gaps in experience, communication, or understanding of complex symptoms. So, the intern is part of the care team, but the responsibility legally and medically belongs to the supervisor. How does an intern affect the medication you are prescribed? Interns cannot decide your medication on their own. That includes diagnosis, dosage changes, injections, prescription renewals, side effect management. A fully licensed doctor, usually a psychiatrist, is the one who approves and authorizes medications, such as Invega Sustenna or any other psychiatric drug. Your medication should always reflect the judgment of the licensed clinician, not the intern working alongside them. If you feel your treatment has been inconsistent, unsafe, dismissive, or poorly monitored, that is usually a sign of weak supervision, not the intern alone. How this affects the theoretical perception of your care. When an intern is your primary point of contact, it may affect 1. The quality of assessment. Interns may lack the experience to recognize complex side effects, understand long-term medication risks, identify environmental or social factors, challenge unsafe or outdated medication practices. This can lead to oversights or superficial evaluations. 2. The accuracy of diagnosis. Diagnosis in mental health is subjective and heavily shaped by experience. An intern may rely too strongly on textbook definitions, supervisors, clinical assumptions, theoretical models that do not match real-world complexity, institutional norms rather than your lived experience. This can create a theoretical perception of you that does not match your actual story, symptoms, or environment. 3. How your concerns are interpreted. Interns may have difficulty interpreting medication-induced physical symptoms, environmental health exposures, trauma-related responses, respiratory complications, social stressors. You may feel unheard because they may not yet connect the dots between medication, environment, and health outcomes. How you can protect your care and stand up for yourself. Here are strategies to strengthen your control and make your care safer. Ask for the name and credentials of the supervising doctor. You have the right to know who is responsible for your treatment. Request that medication decisions be discussed directly with the supervising psychiatrist, especially with injections like Invega Sustenna, which have long-lasting effects. Document your symptoms, side effects, and environmental exposures, respiratory issues, chemical exposure, mold, ventilation problems. These matter. Request a second opinion if something feels unsafe. You are legally entitled to one. Bring up concerns about interns to the clinic director or patient advocate. If supervision is weak, they must address it. 1. Is it legal for an intern psychiatrist to prescribe medication without supervision?
No.
It is never legal. A psychiatry intern or trainee Cannot prescribe independently, must have a licensed supervising psychiatrist, cannot make final diagnostic decisions alone, cannot change dosages, order injections, or start meds without supervision if an intern prescribed you medication on her own, without a licensed psychiatrist approving it. That is a serious violation of medical law, clinical ethics, facility policy, patient safety standards. This should never happen. 2. What are the risks and effects of being treated by an unsupervised intern? A. Misdiagnosis. Interns are still learning. Without guidance, they may misinterpret symptoms, overlook environmental factors, confuse medication side effects with mental illness, mislabel normal reactions as psychiatric symptoms. This creates a distorted and unsafe treatment plan. B. Dangerous medication choices. Without supervision, interns may prescribe medications that are too strong, overdose or underdose, fail to evaluate medical history, ignore respiratory or cardiac symptoms, miss life-threatening side effects. This is especially dangerous with injections like Invega Sustenna, which cannot be easily reversed. C. Lack of monitoring. A licensed psychiatrist must monitor blood pressure, heart rate, respiratory complications, mood, behavioral changes, side effects, long-term risks. If an intern does this alone, your treatment becomes unsafe and unpredictable. D. Increased physical harm. Unsupervised psychiatric prescribing can lead to respiratory infections, heart complications, neurological changes, immune suppression, agitation, anxiety, or sedation. Interactions with environmental exposures. This can worsen your physical and mental health. E. Legal, emotional, and psychological harm. Being treated improperly can cause loss of trust in the care system, confusion about your diagnosis, feelings of being manipulated or controlled, fear of speaking up, worsening symptoms due to fear or stress. These effects are real and valid. 3. How does illegal or inconsistent practice affect your treatment? Illegal or unsupervised treatment creates 1. A false medical record. If an intern enters diagnoses or medication plans without supervision, your record may not be legitimate or accurate. This can affect future treatment benefits, housing eligibility, disability claims, emergency care. 2. A distorted clinical perception of you. Your documented symptoms may actually be medication reactions, environmental gas exposures, stress responses, respiratory illness, misinterpretations by an untrained intern. This creates a false identity in the system. 3. A violation of your patient rights. You have the right to competent care, license, supervision, clear explanations, safe medication practices, informed consent. An unsupervised intern violates all of these. 4. What can predatory or unethical behavior look like? I'm not accusing your intern of predatory intent, but I can describe warning signs of unethical or dangerous practice in mental health care. Predatory or unsafe behaviors may include 1. Working outside their legal scope, prescribing without credentials, making diagnoses without supervision, making independent medical decisions, failing to document a supervising doctor. 2. Using power imbalance to manipulate or silence you, ignoring your side effects, dismissing your symptoms, blaming you for medication reactions, pressuring you to accept injections, refusing second opinions, telling you your concerns are mental instead of medical. 3. Hiding their training level, failing to tell you they are an intern, giving the impression of being fully licensed, not disclosing their supervisor's name. 4. Neglect of medical safety, not checking your respiratory symptoms, not reviewing your medical history, not explaining risks, not informing you of alternatives, ignoring environmental exposures, continuing medication despite harm. 5. Lack of transparency, no documentation, no informed consent, no explanation of decisions. These behaviors are red flags. 5. What you can do next. You have rights, and you can take self-protective steps. Ask for the supervising psychiatrist's name today. You are legally entitled to it. Request a medication review by a licensed doctor. You do not have to justify it. Request your full medical records. Use them for clarity and protection. File a complaint with patient advocacy or ombudsman, especially if injections were given without proper authorization. Ask for a second opinion outside the facility. Your right by law. Document everything you experience: dates, symptoms, medications, names. Protect your physical health. Respiratory symptoms deserve real medical evaluation. Understanding the legal and ethical boundaries of psychiatric care is essential for protecting one's health and safety. Mental health consumers may sometimes encounter interns or care teams operating outside their authorized scope, placing patients at risk of misdiagnosis, unsafe medication practices, and neglect. Recognizing the warning signs of illegal or unethical behavior empowers individuals to advocate for themselves, seek proper supervision, and ensure that their treatment is both safe and compliant with professional standards. 1. Independent prescription by an intern. The intern prescribes medications, adjusts dosages, or orders injections without a licensed psychiatrist reviewing or approving it. Medication decisions are made without informed consent or full explanation of risks and alternatives. 2. Lack of supervisory transparency. The supervising psychiatrist's name is not provided when requested. The intern claims to be fully licensed or fails to clarify that they are in training. Decisions are made without documented oversight from a licensed clinician. 3. Inconsistent or false documentation. Medical records lack signatures or approval from a licensed psychiatrist. Diagnoses, prescriptions, or treatment plans appear incomplete or contradictory. Records do not reflect follow-ups, monitoring, or response to side effects. 4. Ignoring patient safety. Side effects, respiratory symptoms, or physical complaints are dismissed or ignored. Environmental factors, pre-existing conditions, or drug interactions are not considered. Emergency protocols or monitoring procedures are skipped or delayed. 5. Pressure, manipulation, or dismissal. Patients are pressured to accept medication without explanation. Concerns about side effects or health risks are minimized or labeled as mental rather than medical. Requests for a second opinion or review by a licensed psychiatrist are denied. 6. Repeated legal ethical gaps. The team repeatedly avoids or delays sharing patient rights information. Informed consent forms are missing, incomplete, or not explained. Patterns of unsupervised prescribing or ignoring regulations are ongoing, not isolated incidents. Maria is a middle-aged mental health consumer diagnosed with a chronic psychiatric condition. She experiences symptoms including mood instability, anxiety, and difficulty managing daily functioning, which led her to seek ongoing psychiatric care. Alongside her mental health challenges, Maria also faced physical vulnerabilities, including respiratory sensitivity and immune system concerns, making careful and supervised treatment essential for her safety and overall well-being. Maria, a middle-aged woman managing her mental health, had always trusted the care system to guide her safely through her journey. When she began seeing a psychiatrist at a local mental health clinic, she was told that her doctor was a psychiatric intern completing training. At first, she felt reassured, believing that supervision and the structured learning process would keep her safe. However, over time, Maria began noticing signs that something was wrong. She was prescribed strong psychiatric medications, including long-acting injections, without detailed explanations of side effects or alternatives. She experienced persistent respiratory issues, chest tightness, and heavy fatigue, yet her concerns were often dismissed as psychosomatic or part of her mental health diagnosis. As weeks turned into months, Maria discovered that the intern was operating without any legal documentation and, crucially, without the supervision of a licensed psychiatrist. Her prescriptions were given independently, her symptoms ignored, and her medical records reflected diagnoses she never fully understood or consented to. She later learned that this intern was not legally allowed to prescribe medication and that her treatment plan had been constructed outside the boundaries of medical law and ethics. The consequences were immediate and severe. Maria suffered from medication side effects that were dangerous and preventable. Maria's experience is a stark reminder that patient safety depends not only on following diagnoses or prescriptions, but on the legal and ethical accountability of the care provider. Her story emphasizes the need for vigilance, patient advocacy, and systemic reforms to prevent others from suffering due to unlicensed practice or negligence in mental health care. Motivational theoretical concluding thoughts from a peer mental health education and counseling standpoint. Understanding the legal and ethical boundaries of psychiatric care is not just an academic exercise, it is a vital tool for empowerment and self-protection. When mental health consumers recognize that interns or care teams may operate beyond their authorized scope, they gain the knowledge needed to identify risks such as misdiagnosis, unsafe medication practices, or neglect. Awareness of these warning signs equips individuals to actively advocate for proper supervision, question treatment plans safely, and engage in care that honors both their physical and mental well-being. Ultimately, fostering this understanding reinforces the principle that every consumer has the right to competent, ethical, and transparent care. Empowerment comes not only from receiving services, but also from knowing one's rights, speaking up when boundaries are crossed, and participating in a treatment system that prioritizes safety, dignity, and holistic health. If you have specific questions or concerns, feel free to share. Hope you found this insightful while grasping the key components. Please contact me if you would like to chat in a peer counseling session revolving around this post or another topic. Mental health revival, seeking to inspire a unique perception of mental health awareness and harm reduction.